us, what is it?
It is. We've been around for a couple of years now in the community, but we are a very unique facility. There are very few like us even in the state. And we're a full-service residential outpatient and sober living facility. We're licensed by the Department of Healthcare Services here in California, and we have the Joint Commission Gold Seal of Approval, which is the highest level of accreditation that you can get. All of that being said, it basically just means we put a premium on quality. We are a facility that likes to deal with the individual one-on-one. We don't have a cookie-cutter approach to addiction. Not one person's story is the same, so we focus and put a premium on individualized care. And we've had our doors open now going on almost 3 years in the Bakersfield community.
Well, I'm glad you guys are here. And so for the next hour, we're going to be talking a lot about what Legacy Village has to offer our residents and our families here in Bakersfield, not just Bakersfield, but all of Kern County. Daisy, I want to ask you, tell me a little bit about what you do for Legacy Village.
At Legacy Village, I'm the clinical supervisor. I oversee the clients and the clinical staff. I help with the initial intakes to help make the client feel a little bit more comfortable when they come in, get a little background on them to help develop an individualized master treatment plan for them, and oversee everything the way that it should be ran.
Well, thank you. Dennis, I want to start with you.
Sure.
What is addiction? Because we hear the word alcohol and drug addiction all the time, and then immediately we get a certain picture in our head. What is it?
Sure. I mean, the stigma, especially around our community oftentimes, is that it's the person who's pushing a shopping cart down the street, or that it only impacts low-income families. And nothing could be further from the truth. The overwhelming majority of people who struggle with this issue are people who you work with. They're people in your church. They're people that you would come across in a normal business dealing. Addiction itself varies by the individual. There's the chemical dependency to a substance. Somebody who's been using drugs or alcohol for such a period of time that their body is chemically dependent upon it. There's substance abuse, which means that somebody is overusing alcohol or drugs, or illegal drugs for that matter. And all of it combined, really what it comes down to is that if you're using a substance, obviously if it's illegal you shouldn't be to start with, but if you're using a substance that's impacting your work life, your family, your productivity, your health, any of those things, to a degree that is having a negative impact on you, there's probably a significant problem there.
So if there's a family out there and what you're saying rings a bell in their mind, and they either want to get help for themselves or they want to get help for someone, what do they do in order to get help from Legacy Village?
Well, you reach out and you give us a call, or you go onto our website, either one, and you start doing some research and you educate yourself. If you're a family member, it's a much more difficult process, because if you're dealing with somebody who isn't ready for help, you've got to figure out how you're going to interact with that individual, how you're going to go through your daily life without letting their addiction impact you as much as possible, and that's not an easy task. So education for the family members, for spouses, for children of parents who struggle with this, educating yourself on not only what addiction is, what services are available, but how to set boundaries and how to deal with that is extremely important. And those are things that we all offer at Legacy. We get a lot of phone calls where we'll spend a considerable amount of time on the phone with an individual. We may never see their loved one as a client, but we're here as a community resource. Obviously, the more information we can get out there, the more it benefits everybody. If you're the person who's struggling with addiction, then it's not a lot different, although you almost assuredly realize you have a problem. And so then it's more specific questions that they ask us on how does the program work, what does it entail, which we also answer in the same way. We give them an explanation. You know, our residential program, which is the highest level of care, is very structured. Okay. Everything from what time you wake up in the morning until what time you go to bed at night, eating meals on a regular basis, making your bed every day. These are things that in the middle of an addiction you lose sight of. Those of us who struggle, and I'm a grateful recovering alcoholic myself, those of us who struggle with it often go through life without focusing on some of just the small tasks that make things work in our daily routines. And so we really start from the beginning and go through and keep people active and busy in rebuilding their life and giving them a foundation with which to recover.
So that residential program, is that sort of the first phase of treatment when someone comes to Legacy Village, or is that what you guys would prefer where people would start?
I think we prefer that they did. I've used again, we have residential, outpatient, and sober living services. But in our opinion, it's very difficult to take somebody who has years or even decades worth of an abuse history or an addiction history and put them into a classroom setting for, let's say, a few hours, and then expect they're going to go right back to the atmosphere they came from and be okay. So it is. In most cases, somebody who struggles with addiction, residential treatment is the way to start.
Daisy, you see a lot of patients coming in and out every day. What piece of advice would you give to someone who's listening right now, who wants to take that step and get a hold of Legacy Village, but they're afraid? What can they expect if they decide to come into this residential program?
I would suggest that they come in and they take a tour of our facility so they can see, because a lot of people believe that they, excuse me, they believe that they come in and it's a locked facility, but it's not. It's a very loving, home-like facility. Residential treatment is what I would suggest to anybody, because coming out of your environment and giving yourself that initial 21 days to be able to find out who you are, once again, without the drugs, learning the routine, like Dennis was saying, you know, learning to get up at a specific time, eat breakfast at a specific time, getting ready for your day at a specific time. In addiction, we don't think about those things. It's we get up at noon, we get up at 1 o'clock in the afternoon, Cheetos and a bag of Cheetos and a Pepsi for breakfast. You know, it's learning all those new routines. So to get yourself out of the place that you're in and coming to Legacy Village and giving yourself a chance and giving us a chance to love you through is what I would suggest.
There is a stigma that it's an institution.
Yeah.
That it's a very...
Bad people go there.
Exactly.
Crazy people go there.
Exactly.
I'm okay, I'm normal, I don't need that.
Yeah. And that's not at all what it's like. Okay. So I would definitely reiterate what Daisy said. You know, interested family members or those who are struggling should come take a tour. It is very much a residential setting. It is not, you know, sterile walls and stainless steel everywhere. It is not an institutional setting. It's important, I think, for people to understand that, because the level of comfort with which we try and give each individual person who comes through our doors is critical to their experience, and whether or not, you know, those first couple of days, that first week is terribly important. And so we do make a lot of accommodations to keep people comfortable.
All right, so if all of you are just joining us right now, we are live on Facebook. We're going to be live for the next hour or so. So if you know of someone who could really benefit from listening to our conversation, we ask that you either tag them on this stream or share or give us a like. Let them know that these two people are here for you for the next hour or so to talk about how Legacy Village can help. So I'd like to invite all of you to go ahead and ask your questions. If there's something specific or something you've been wondering about and you don't know where to go or you've never known who to ask, this is your platform. This is your space and your time. Ask some questions, and I'm going to be looking through our feed right now and see if there's questions that we can take that maybe either one of you can answer. So let me take a moment here and take a look real quick. I have a question from Jessica, and she wants to know, do you confront a family member that you suspect might be using? If so, how do you do it? When do you do it? And where?
That's a lot of pieces to that question. More than likely, if you've got a suspicion that somebody's using, you probably have more knowledge of it than just that. That being said, yeah, having an open and honest dialogue is critically important. And talking directly to the person who asked the question, I mean, you've got to have that discussion with somebody, no matter how uncomfortable it is. If you don't, you're running the risk of, you know, this is a deadly disease. This is something that, if left untreated, will kill the individual. And so if you're not prepared to do that yourself, You can do it in conjunction with other loved ones, other family members, basically have a family intervention. If that's something that you're not comfortable with, intervention services are something that Legacy offers. And that process really entails us sitting down with the family members long before we ever meet the person who's struggling with addiction, finding out some basic history, what they've got going on, what boundaries that family is willing to set, what limits, and then coming in a very loving but a very firm approach to say, you know, here are your options. You know, we understand that you're struggling with this and we're here to support you, but we aren't going to tolerate this behavior. So here's what we're willing to do, or you can go get the help that you need. You know, and we're advocates for, while we're very proud of our facility and we're very proud of the efforts we make for high quality and for individualized treatment, at the end of the day, we don't care where somebody gets help. We just want them to get help.
The other thing that we wanted to talk about, we were talking a little bit about this earlier, is what if that person doesn't want help? Because there are parents out there who have their teenagers or maybe their young adult children who are going through something like this. The parents want to help, but the addict isn't physically going into Legacy Village. What happens then?
Al-Anon, and Daisy can probably go into this a little bit, is a great resource. It's obviously an entity that's not tied to Legacy. It is an offshoot of Alcoholics Anonymous that is designed for family members. And you want to tell them kind of what the resources are and how that works? And
Al-Anon is for the family members of the addict and the alcoholic, that gives them support to let them learn how to set boundaries, healthy boundaries, not only for the addict but for themselves. Because, and it also, they also help you to really be able to protect yourself emotionally. Because a lot of times we allow the addict to continue using in our homes, taking money or whatever it is that they're doing out of love, care, concern, but in all reality it's just enabling them and hurting them a little bit more.
And I would also tell the person who asked the question that, you know, an overly confrontational mindset is not going to help you. That person knows that they've got a problem. And obviously, I would assume if it's been going on for a while, there have been lengthy arguments about that subject before. So there's no need to do it out of anger. There's no need to do it out of a sense of, you know, overly dramatic terms or things like that. You know, be frank, be honest, set your boundaries, and stick to them.
Okay, we have another question coming in right now. And Daisy, I'd like to ask this to you. Sarah wants to know, do you have an evaluation process for someone to be able to walk in, get evaluated mentally, but also be able to go home that same day? So I think they're asking more about the mental aspect and mental changes that come with addiction. Is there something like that?
Yes, we do have a questionnaire that we do. Someone can call in and do it, or they can come in and we can sit down. And usually if you sit down and you realize, when you are asked the questions, you can realize that, oh, okay, I think I've got a problem. So sometimes they won't leave after that. But yes, they can come in and ask the questions and sit down and talk with us, and then they can leave right after that.
And Legacy Village is a dual diagnosis facility, so we're equipped to deal with other issues besides chemical dependency.
Okay.
Our primary focus is addiction, but many or oftentimes people come in and they're struggling with depression or with bipolar or another, you know, diagnosed condition, and we are equipped and licensed to be able to handle those things.
And I have a little bit of a success story to share here. I'd like to share Michael's comment. He says, I've been clean since August 13th of 2010, so in a couple of weeks I will have 8 years clean, and I have known
Awesome.
Daisy since the day I got clean. So you guys are making an impact, Daisy.
That makes me happy. I love to hear success stories. That's a part of why I've been in this field, is, you know, to hear things like that and to know that I made an impact somewhere, just like someone made an impact in my life.
Daisy, let's talk a little bit about that, if you don't mind. You specifically went into working with Legacy Village because of your own success story. For people who are watching out there who think maybe I can't get out of this, or this is too hard, or you know, I've known someone who's been like this for years. What do you have to say to them? Because you're a success story yourself.
You know, I thought that I was going to live and die doing drugs for my entire life, and going into treatment where I didn't want to, but I was made to, something clicked. And I realized that I didn't want that life anymore, and I was able to get the strength and the courage to go back to school, get a degree, and get into this field. This really wasn't my chosen field. It was actually something else, but it chose me, and I know that God had a lot to do with that. And I have been in the field for 10 years now, and I love hearing successes. I love being able to sit here today and, you know, thanks to the treatment center that I was in and the grace of God, and be able to give back to the community, and where I've taken from so many years, I'm able to now give back. I'm able to give wives their husbands back, mothers and fathers their daughters back, kids their parents back. You know, this is a very big passion of mine, and everything that I do with Legacy Village comes from my heart. I'm a little strict sometimes, but it's because I have love and passion for the clients that come into our facility, because I believe that everyone deserves a second chance. And if I can be a part of that and help them to get that second chance, I will go and bend over backwards to do what's needed to be done.
So thank you. So let's talk a little bit about Legacy Village. You said there's 3 major components that you guys offer, right?
Yes.
The first one you guys would like everyone to start with is obviously the residential program. Can you talk a little bit about the other 2?
The outpatient and sober living. I can. Before we get to that too, I want to mention, you know, 90% of our staff are in recovery themselves. The overwhelming majority are. So that's always a comfort for both the family members and the person struggling to realize that anyone you're dealing with, whether it's a registered recovery worker that facilitates daily movement, to our clinical staff and even our clinical director, are in recovery.
So you have people who understand, you know yourselves, the people who are working there, it's not just a job. They're not just taking patients in and filling out some paperwork. They know on a more personal level what these addicts are going through.
Exactly. They've lived it.
Yeah.
So, our other levels of care, again, outside of residential, go into the outpatient level, which can be as intensive as 5 days a week and down to 1 day a week. Think of it as a progression. You're in the intense level of residential, you go into a 5-day-a-week program at outpatient, that goes down to 3 days and then down to 1 day. Sober living is a little unique in the respect that, you know, not everybody, like we kind of discussed earlier, not everybody has the opportunity to go back to a loving, welcoming, nurturing family environment. Sober living is designed so that they have some accountability. There are curfews, there are minor rules, there are chores, things like that. There's random drug testing. It gives them a level of accountability as they ease back into the freedom and the quote-unquote real world. And so we encourage people who may be in that in-between state, they don't have a safe home environment to go to stay on with us in a residential setting that has a lot more freedom than the residential treatment aspect of it. And that progression can do wonders for an individual. Like I said, not everybody. Or on the flip side of that, if somebody has lived on their own and struggled with this disease for a while, you know, their credit score is not great. Their finances aren't great.
Right.
They may not be able to turn on a PG&E bill. And so this allows them to afford to live while they put those pieces back together, while they clean up what we call the wreckage of your past.
Okay, now, when we were talking earlier, we were talking about how not every alcoholic is going to have the exact same treatment or the exact same sort of life when they go out. What can people expect? Because you were telling me when someone comes in and after they've been evaluated, how do you determine what patient gets what kind of treatment?
Well, across the board, everyone gets the same level of care.
Okay.
From a clinical standpoint.
Yes.
But what we like to do and what we put a premium on is in the initial 5 to 7 days of an intake, we really get to know the person. We have a thorough history done on their their past, on their medical issues, on their usage history, their family dynamics, their education level, everything under the sun. And we use that information and that initial 5 days to determine what we call a master treatment plan.
Okay.
Now, some people may have some very serious and very emotional trauma in their past, in which case they would need to probably see our licensed marriage and family therapist on a more regular basis, perhaps 2-3 times a week. As where somebody who doesn't have that may only need to see them once. So we look at those specific issues that are impacting an individual and determine what groups they'll participate in, what individual counseling sessions they'll appear in, what individual therapies they'll have. And then we put that package together. Okay. And that's during the course of the day. Like I said, it's a structured day. Yeah. And so during the course of that day, those are the things that they'll participate in.
Okay. I'm looking through our Facebook feed right now, and there are several comments where the theme happens to be the same. They all want to know, how much does this program cost? Do you take insurance? What about Medi-Cal? Let's start there. Let's break down sort of the two themes that I see here. And the first is cost and financing. How does someone begin to take care of something like this?
We talked about this before we started. It isn't cheap. And we throw that out there because I don't want to put any misconceptions out there. Private insurance, more often than not, covers the majority of the stay. We do have private pay options and finance options available. Right now, we aren't able to take Medi-Cal. It's something we're in the process of, but it's a very long process. I would expect sometime towards the end of the year, the beginning of next year, we'd be able to take Medi-Cal recipients, but at this point, we're not able to do that. The overall cost can range anywhere from $12,000 to $15,000 a month, which is, I know, a lot of money. It is about half of what you'd pay in the Southern California market. It's half of what you'd pay at other facilities. We do our best to keep costs down as much as possible because we know what kind of a financial impact it has on a family or an individual. That being said, what you're talking about is treatment for something to save your life. And for those individuals, you know, we're very much geared towards a middle class, working class, blue collar, white collar client that comes through our door most often. So you've got an administrative assistant who makes $40,000 to $45,000 a year. If they're using or abusing alcohol or drugs, it's only a matter of time before that job's gone. So it is an investment in your future, is what it is.
Yeah, and I have someone here who says, Robert, I want to share a little bit about what you wrote. He says he's been clean since 2011. He got tired of being tired. And he says, to those who are truly tired of being tired, recovery is possible. By all means, it's not easy, but it's definitely possible. And I think that rings true to what you were saying. You know, when you look at a facility like Legacy Village, and then you start thinking about finances, well, what is the reward that you're getting out of it? And you mentioned it, you know, it's saving your life. And as we have Robert here saying, you know, it's not going to be easy, but it definitely is worth it.
More often than not, an addict or an alcoholic has wasted thousands, if not tens of thousands of dollars, either in their actual addiction or because of their addiction. Whether it's lost relationships and divorces, whether it's bad financial management, whether it's loss of employment. The amount of money that this disease cost, not only the individual but our communities, is staggering. So while at one time, yes, it is a lot of money, it also is very small in comparison to what we're talking about doing.
There's a theme sort of running through here through some of these comments that I'm looking at. And it sounds like, okay, it sounds like this one person lives either out of state or out of the county. Do you have to be a Bakersfield resident?
No.
No, you can come from Los Angeles. From
anywhere in the
place.
country.
Okay, let's talk a little bit about that. What does somebody have to do? Just pick up the phone, call you guys and say we need help?
Certainly.
Okay.
We've had many clients come from the Midwest and other places across the country, and yeah, what they need to do is pick up the phone, ask the questions, give us the information about the individual, and then we let them know what needs to happen. Obviously, if it's an insurance client, then we know that there are certain things that are covered and then how that's going to get handled, and we deal with the family with that. If it's a private pay client or financing, we deal with those issues and get that kind of stuff set up. But logistically, it's not a difficult process to get somebody here from wherever they may be at. And geographically, it's not always a bad idea. You know, there's a couple of schools of thought on this, but if you're a working professional, if you're an attorney, and you struggle with this issue, you don't necessarily want to run into people you know in the community as you're first getting help. It's scary. There's a lot of fear around this disease. And so your first week or 2 weeks or 3 weeks of seeking treatment, you don't want to run into somebody at the store. If we're on an outing with the clients, you don't want to run into people that you know. So getting outside of their comfort zone, getting outside of their home area can be hugely beneficial.
I want to ask Daisy, so if someone comes to Legacy Village and they've talked to you guys and they know sort of the resources and they've figured out their finances, but for whatever reason, they decide that Legacy Village is not the right fit for them, what can you do for them?
We do refer people to other places because not every treatment center is for everyone.
Right.
But we do our best to help the client to feel comfortable, to know that they are going to get great quality of care with us. But if that client would decide that they didn't want to, we would help refer them, because it doesn't matter where they get the help as long as they get the help.
I'm looking through some of our questions here, and I want to ask, so we've talked about the 3 major components, right? What happens afterward when we are, let's say someone's gone through the program and they are successful, because we've talked about success and what it means, right? One day at a time. Then what happens when the person leaves your facility? Is there help for them or some sort of support after they leave you guys?
There is. We have a very vibrant alumni program that anybody who graduates our program and remains clean is able to come back on the facility pretty much at any time. If they're having a rough day and they just need to pop in and say hi to the newcomer, we welcome that.
Okay.
It not only helps the new clients who came through the door, but it helps tremendously with the person who's just recently completed the program. And our clinicians are available to anybody who's gone through it. It's not like you've graduated, it's day 28, have
You're
a nice
done.
life. We don't do that. We've got people that we've stayed, you know, like I said, we've been in business almost 3 years now. We have people from the very beginning that we still stay in touch with. Daisy actually takes the lead on our efforts to keep in touch with as many people as possible. So,
Daisy, tell me a little bit about that. Over the course that you've been working there, obviously you've come across a lot of people. What are maybe some of the things that you do personally to talk to people once they're done with the program?
I make the effort to call them to see, just to check in and see how they're doing, ask how life has been. And I pretty much in the beginning, when they get there, from the time they get there to the time they leave, I do my best to build a rapport with them, so that way I don't even have to really make the calls. They call me and they'll let me know how they're doing. They'll tell me about a celebration. They'll tell me about a grandbaby's birthday, or, you know, the wife and I just went to Hawaii, or whatever the case is, and they love to call in and share, and so they keep in contact with me a lot.
Daisy, I have another question for you. Margie wants to know, does this center use recovery coaches? I'm not quite sure what a recovery coach is, but they want to know if we use, or if you guys use recovery coaches.
I'm not sure if she's referring to like sober coaches or things like that. There are a
Okay.
lot of facilities, and it became very popular in Southern California, where an individual basically shadows somebody as they go through daily life. It isn't necessarily a service that we focus on because we rely so heavily on our residential treatment.
Okay.
By the time somebody's completed a 28, 30-day stay and then has an outpatient plan and a follow-up plan, the need for somebody to shadow them isn't so great. So it isn't necessarily something that we participate very heavily in. We do have opportunities. I'll give you an example. We had somebody from the Midwest who came through, and they had to go back for an important court case.
Okay.
And so we actually sent staff along with them for the 3 days that they were gone, so that they weren't by themselves. Now, they were only in their 3rd week of treatment.
Okay.
So it was very early on, and not only did they not feel comfortable going on their own and going back to their old stomping grounds, we didn't feel comfortable with it. So we made arrangements and did that. So in those scenarios where somebody needed to leave the facility for medical necessity, for perhaps a legal matter or even a family matter. We've had people leave to go to funerals or things like that. Of course, we would send somebody with them, and that, in essence, is what you would consider a recovery coach on our end. But as far as a standalone service, no, it isn't something that we do.
I want to ask you, what makes Legacy Village stand out so much in the county versus someone maybe wanting to go out of their way to seek help like in Fresno or in Los Angeles?
I think it's our individualized care. I think it's the fact that we get to know everybody who's came through our door on a very intimate level. Not only what it is that they've been through leading up to them coming to our doors, but what their aspirations are, what are their hopes, what is it that they want to achieve, not only in the short time that we're going to have them, but in the next year, the next 5 years. I think that one of the consistent things we hear from our clients, those who have gone through the program and completed, is how much we care. I think that that's something that you can't fake. A client, especially an addict or an alcoholic, and I can say this, being one, we know when somebody's trying to pull the wool over your eyes. We know when somebody's not genuine. And our clients do. And if you're going through the motions, if you're doing what the next indicated thing is on the paper, and you're not engaging with that individual, and you're not exhibiting the concern that we feel is necessary, they're going to know it, and they're going to feel that, and it's going to dramatically impact how successful they are.
And I have a comment coming in right now from Raina. She says, "Go Legacy Village. Daisy is a legend in the residential treatment community. Legacy Village is so lucky to have her."
We are.
So I think comments like that are really a testament to what Legacy Village not just offers as a treatment center, but you guys keep talking about the human aspect and the humanity that you guys share, because a lot of the people there have been through it. You know what you can relate to the clients that are coming in.
Yeah, and that's crucial. I think Daisy is a great asset to Legacy Village, and now don't let her fool you. She's not always the nicest person. She holds these guys. She holds their feet to the fire when it's necessary, but she does it out of a place of love and concern that is obvious to everybody she deals with. So
tough love, right?
Very much so.
Dennis, I wanted to ask you, so Legacy Village has been around for about 3 years.
Yes.
Share with us a little bit about how this was your brainchild and why you decided to take this on and bring this into our county.
I tried to get sober a couple of times, and it didn't stick the first two. When I was in a position to go for a third time and I was looking for a facility, there wasn't something easily accessible around here that fit exactly what I needed. There's a lot of great programs in this community, and there are a lot of great people who work at them. We deal with them on a regular basis, and my hat is off to all of the people that are in this field around Kern County and in Bakersfield. But for me, I didn't find something at that particular time that was a good fit, and I wound up in Southern California, and it was there that, combined with the lack of access to something for me to go to, and a willingness to do something different with my life, that I kind of had the idea. And it started off as a very small men's sober living operation at the very basic level of care. And over the course of about 18 months grew into the licensed facility and the company that it is today. And so, that credit, like I said, both my recovery and the fact that Legacy is here is by the grace of God. So.
The other thing I wanted to ask you, so Legacy Village has been around for 3 years. You guys have been working it, trying to figure out sort of what works best for each client. Dennis, what would you tell me is by far, bar none, the best service that Legacy Village offers that people aren't going to find someplace else?
Our staff. The fact that we employ predominantly people who are in recovery themselves, that we employ people who have a vested interest in being in this field and helping other people. I can't tell you how many times we have issues at 1 in the morning or 3 in the morning or at any given point of the day where people are willing to leave their home, go down to the facility and deal with what needs to get dealt with. I can't tell you how many times our recovery workers sit down and counsel people one-on-one. A lot of the times when somebody wants to leave or they're having a really hard time getting through the initial stages, it's our entry-level recovery workers that are there that see them. They're the ones that, quote-unquote, talk them off the ledge. And so being able to, again, it comes down to individualized care. It comes down to giving them what it is that they need. And that's not always what they want to hear right at that moment. But when you do it from not only a place of love, but when you do it from a place that is absolutely genuine, it is all the difference in the world.
So I want to talk a little bit about addiction and sort of not just what it is, but how does somebody recognize it? Because Daisy, we were talking earlier and you said, you know, when you were young, it was just about partying and hanging out with friends, and it was just a drink here and just a drink there. But then what happened?
Then the drugs came into play. The disease of addiction is progressive. You know, where I thought that the weekends were, you know, for parties and friends and hanging out, became an everyday struggle. It was every day that it took precedence over everything in my life. And if you think that you can just do one, it doesn't last very long. It took my life on a tailspin to where I never believed that I would ever go to the depths that I went to. And coming out of it wasn't easy, but it was something that I am so grateful that I was able to come out of.
Yeah, and for you, you said it was your children, right? It was the love for your children. You saw how your family was being torn apart because of this, and that's what finally made it click for you.
If it wasn't for my children, I wouldn't be where I'm at today. They gave me the strength, the unconditional love, the courage to be able to be the woman that I am today. If it hadn't been for them and the struggle to fight for them, I think I would be in a casket by now.
So for people who are watching us right now and listening to your story, what would you say to them to encourage them to recognize that there is in fact a problem and take that first step to get some help?
You know, like Dennis was saying, that it is a costly process, but at the same time, the way that I had to look at things when I got into treatment and got clean was that, you know, the amount of money that it costs to go into treatment is the same amount of money that you're going to pay for a funeral. You know, what I would say to anybody that, you know, there's resources available to you wherever you're at, in whatever stage of your life you're in. I was a mother on welfare that didn't have anything, and places like Legacy Village weren't available to me, but there was other places that were available to me. And it's just picking up that phone and making that call.
Dennis, let's go ahead and give everyone that phone number. If people are ready to pick up the phone and make that call, what is the number?
It's 661-846-2745. Or you could visit our website at www.legacyvillagellc.com. We are open 24 hours a day. We have live staff members at the facility 24 hours a day, which is crucial because, you know, addiction's not a 9-to-5 business. And I'd like to kind of piggyback on what Daisy said too about the progression of this. You know, if you've got a loved one who you've noticed is calling in sick more often, or let's take this back for a second and look at it from the employer standpoint. If you've got an employee who's been a great employee, you know, we all know as employers it's difficult to find, to train, to retain people in our workforce. If you've got somebody who's been doing very well for you and then recently they're missing more work, they're looking more tired, perhaps you've smelled something on their breath that maybe you didn't smell before, you know, employers can not only advocate but can assist with employees getting the help that they need. And financially can assist, because it still is a scenario where it's cheaper if you can retain a great employee and save their life. We have that happen quite frequently, actually. But those are things that everyone would start to notice. Your family members, if they're wondering whether or not you're struggling, I think one of our initial questions was, how do I know, or how do I approach them? You know, you'll see physical signs, you'll see emotional signs, you'll see things that will strike you as this person's just not quite the way they were. There's something off. Don't wait until they are so far into it that it's blatantly obvious. Have that conversation, have that discussion.
Let's talk a little bit about sort of how addiction can sort of begin to spiral. Daisy gave us her example that, you know, for her and for so many others who are watching, it does start like that, just partying and hanging out, and one little thing sort of leads to another. So for young adults out there, the question is marijuana really a gateway drug?
I don't know that my answer on this question is always politically correct, but I'll do my best with this one. You know, whether or not marijuana has medicinal value, any of that, we really don't get into any of that. At the end of the day, my personal opinion is if it does, then package it and sell it at CVS or Rite Aid. Because when you go down, you know, streets in East Bakersfield and there's a pot shop on every corner with neon lights, you're not selling medicine, you're selling a culture. And what that's done is it's made it socially acceptable to the youth. If somebody's 45 years old and they want to smoke marijuana as a recreational thing and they don't have an addiction problem with it, I suppose that we don't have much to say about that. But when you've got kids at 14, 15, 16 that think it's a normal thing and that it's socially acceptable, they're already not developed. And so you lower their inhibitions and it's going to lead them to drinking it to excess, to trying other drugs that they may not have tried before. You know, we're a program of abstinence, and we do that for a reason. Marijuana was never my thing, but if I was to go out and get high right now, it would be a short amount of time before I had a drink back in my hand, because it would lower my inhibitions. And it's no different. You've got somebody who methamphetamines or heroin is their drug of choice. They go out and get drunk enough to where they lower those inhibitions. It won't be long before they have their drug of choice back in their hand. So obviously, from the marijuana standpoint, older adults can make responsible decisions, and if they're making responsible decisions, we don't really have a take on that. But as far as having it accessible or making it accessible, I think it's very detrimental to the youth of our community.
And you mentioned teenagers. Legacy Village, is this just for adults?
It is. We do have some referrals where we can send people. Adolescent facilities are a little more specialized. They require some additional things that obviously you can't combine the two. So at this point, it's just 18 and over.
Okay, I've got a question coming in from Vanessa. She wants to know, how do you encourage someone struggling with addiction to stay in a program?
I think a lot of it has to do with the program. I think that, you know, unfortunately, there are a lot of places that I call warehouses. There are a lot of places that you'll get the exact same thing that anybody else would get. It's running them through in a assembly line factory style. Every week, the curriculum rotates to the same thing. That makes it very difficult for somebody. So I think the choice of facility has a lot to do with it. The amount of support that they get from their family has a lot to do with it. There's a lot of components that go into it. At the end of the day, the most important component in this process called recovery is somebody's willingness. You don't have to know how. You don't need to know how it's going to work, why it's going to. You don't even need to know why it's going to work. You just have to be willing to let it work. And if you are, miracles happen, and we see that all the time.
Dennis, thank you. For those of you who are just joining us right now on 23 ABC Facebook Live, we are speaking with Dennis Farmer. He is the CEO of Legacy Village. It is a recovery center and a sober living facility right here in Bakersfield. They've been in town for about 3 years now, and they're reaching out to all of you today. If you know someone who is going through alcohol or drug addiction and you don't know where to turn to, they are opening the doors to Legacy Village, and they are inviting you to pick up the phone and make that call, and that's the very first step. Dennis also brought with him Daisy Graven. She is a clinical supervisor. She works with families and patients every day, so she knows firsthand what it's like to have people come in, and when you greet them and you give them a warm welcome, to make sure that Legacy Village is going to be the place that's going to help them get people back onto the road to recovery.
Yes.
Dennis, I want to ask you, is there anything in particular that you would like people out there to know about Legacy Village that perhaps we haven't discussed yet?
I don't know if there's one thing specific. I think what I'd like to mention is more of an industry-wide type thing, and we discussed this before we got started today. A lot of times people ask about how successful you are. What's your success rate? And I liken it to other industries, because I think that the addiction industry and the addiction treatment industry gets put under a level of scrutiny that other places don't. I'll give you an example. If somebody struggles from diabetes and they have a blood sugar level that's gone through the roof that requires them to go into the hospital, they may have to stay there for, let's say, a couple of weeks. If the hospital gets that blood sugar under control and shows that patient how to deal with their blood sugar and keep it under control, and they leave there 14 days later and it's under control, we would consider that hospital stay a success. Now, if the individual doesn't take their insulin or doesn't take their medication and 5 days later they wind up right back in that scenario, we don't blame the hospital. And it isn't so with this industry, although I think it should be. You know, we get somebody in there who has a chronic relapsing disease. We're going to get them stabilized. We're going to get them information and education and tools to keep that disease stabilized, to live a healthy, productive life once they've left our facility and our programs. If they don't take their medication, it's something that's outside of our control. Obviously, we try and give them as many tools as they need to understand how vital going to meetings, talking to a sponsor, quote unquote, taking that medication is. But ultimately, it's their responsibility to do that once they've left our facility.
Daisy, I want to ask you, for people who are considering Legacy Village right now, they've been watching, they've been listening, and they kind of want to take that first step. Is there a way where maybe someone can just come in and check out the facility, maybe take a tour, look around, and maybe get comfortable with the idea of finally getting into Legacy Village?
Absolutely. I would suggest coming down because a lot of people think that it's this bad place, and it's actually a beautiful place. It's full of love. It's full of a lot of care and concern. It's very homey. And to get rid of the fear, I would suggest coming down, taking a look around, asking us all the questions that you have to ask to help get rid of that fear and take that initial step to come into treatment.
Daisy, paint a picture for us, if you will. What does this place look like? It's located on California Avenue, correct?
That's the corporate office.
That's the corporate office. Okay.
We have our main residential facility is over on Oregon Street.
Okay.
And then we have outpatient facilities that are on Monterey and other areas in that on that side of town over there. So,
yeah. So paint a picture
of the
for
facility?
us, because you said it's very homey. Give people at home an idea of what they would be walking into.
When you first walk in, you're going to see well, actually, we just remodeled. It's a beautiful kitchen, dining area, actually, with these beautiful new tables that Dennis just painted yesterday. And that's one thing that sets Legacy Village apart from everything, is the way that he gets in there, and he's really in the trenches with us, dealing with clients and dealing with them one-on-one individually, and really being there and showing the care and concern. But you see a living room like setting. It's not the traditional tables and chairs like a normal classroom.
Okay.
There's couches, there's TVs. We show a lot of educational videos that deal with addiction to help a client be able to see themselves in that video. And it's not just us, well, you are, and because they've gotten that from their families long enough.
So it doesn't look like a hospital. It doesn't look like
No.
a
Not
clinic. It's
at
not
all.
sterile.
No.
Townhomes with a beautiful living room, with a kitchenette. The only thing that's missing in there is a stove, because we have an amazing cook that works there, and we have a beautiful kitchen. On the outside are their little townhomes, 2 bedrooms. There's a little, what would you say?
It's very much like apartment living.
Okay.
It very much is. It's very comfortable and set up like apartment living in the residential part of it. It's all on the same property. But I think back to what Daisy was talking about with the classroom areas and stuff like that. It is very warm and inviting and comfortable. Oftentimes, the therapy that happens with just clients talking amongst themselves is as valuable as anything we can give them. And so creating an atmosphere that is both conducive and comfortable for those guys to sit and talk to each other is extremely helpful.
So we've been talking a lot about the addict or the alcoholic and the type of help that they can get. Can you give me some more details about sort of what the families will walk away with after someone completes a program through here?
Sure, and it actually doesn't start when the client completes. The process of dealing with individuals' family members starts from day one. We have a licensed marriage and family therapist on staff who actually also is our clinical director. He's an amazing man who is in recovery himself. And he deals not only with the individual client when they come through the door, but he'll deal with their family members. He'll deal with them outside of the client. If they have concerns or questions or anything's going through their head, we offer those services. It's part of the package that comes with anybody coming into Legacy. And that doesn't stop. That goes through the entire process while the client is with us. We work heavily on family reunification issues. A lot of times spouses have really done some damage in their relationship over this issue. So we work to help them get on a path to repair those things. Parents have damaged their relationship with kids or kids with their parents. Those are all things that we not only work directly with, get in there and get our hands dirty with, but we continue that care after the person has actually completed the program.
So the whole family is sort of not being treated, but being cured and being healed and moving forward after something like this.
We encourage them to be as involved as they'd like to be. So as long as it's both healthy and beneficial to both the client and the family, we encourage them to be extremely involved.
Okay, the other thing I want you to do for me, tell everyone the website, because I was looking through it yesterday and it is a wealth of information. What can people find on your website?
The website's at www.legacyvillagellc.com. It goes through some staff biographical information to let you know who we are, where we've came from, some of our background information. It gives you some general information on the facilities, the type of programming that we offer. It also has an ability for you to go answer some questions. If you think that you or a loved one might be struggling with a drug or an alcohol addiction, it allows you to answer a set of questions there. You know, this disease is unique in a couple of ways. One, it's something that really only you could diagnose. You know, you've got to be able to answer those questions to determine whether or not you're actually struggling with it, and it's a disease that will tell you you don't have it. So one of the reasons that relapse is so prevalent, one of the reasons that people struggle with this is because whether or not you've got 1 month or a year or 10 years, there are moments and times where it will tell you that you don't have it, that you're fine, that you can drink and or use like a quote-unquote normal person would. And that's not the case. So we've got to be cognizant of that. So those tools and those resources are available on the website, as well as our contact information. There's also a live chat feature on the website, so if somebody would like to ask questions, they can do it that way, or they can submit their questions.
Who are they talking to? Who's on the other line?
A staff member at Legacy. So yeah, it's all done internally.
Okay.
So we have either recovery technicians. I myself have it on my cell phone. So there are times where I'm the one that's on the other end of it.
And you mentioned something that a lot of people might not think of when they hear of drug addict or alcoholic, and that's the word disease. Can you give me a little more information on that?
It's classified as a disease, and it has been, I believe, since the 50s. You know, there's a lot of debate and a lot of argument. Some people, that ties into the stigma part of it. Some people don't think it's a disease. At the end of the day, we do. We don't see the value necessarily in the debate over it. At the end of the day, if somebody's life is falling apart because of drug or alcohol usage, it's our job to help them try and put it back together. And so whether or not you call it a disease or anything else, we know that we offer tools and help that can get that person back on track. And so that's what we'd like to focus our energy and our efforts on.
Daisy, tell me, what is the best part of working at Legacy Village? You've been there for a little while, and I know you talk to the families and stuff, but day in and day out, what is the one thing you most look forward to coming to for work every day?
Well, I've been with Legacy Village since it began. When we had not one client, we sat and cleaned and put everything together. So I would say what makes it a place that I want to come to every day is the staff. It's the staff. I mean, everybody is like family there. You know, Legacy Village is like no place I've ever worked before. I could never see myself leaving Legacy Village.
And I'm looking at our Facebook feed right now, and everybody's saying hi to Daisy.
She is well known.
She's well known. Apparently, she's very well liked there. But you know, you were talking about how, you know, sometimes you have to get tough, and it's not tough to be mean. We've talked about it earlier. It's tough love.
Yes.
Tell me a little bit about you said, you know, you had someone who got tough on you in your life, and you didn't like it, but it made a difference.
It makes a huge difference. where my family tried to get tough with me, I wouldn't stand for it. It wasn't going to happen. But when I had someone in my life telling me, and it was actually my social worker, she said, look, young lady, I don't know who you think you are, but you don't run anything. You're going to learn that I run everything. And the day she said that to me was the day that my life changed, and I realized that I better listen to someone else, or else life was not going to be okay for me. And I've had quite a few young ladies come through that I've had to say, look, young lady, you don't run anything around here. And you know, a lot of those ladies I have that I can call today, and they can tell me how wonderful their life is going. You know, sometimes it takes that tough love, and it's just like, they're like my children. And the same tough love that my children get, they get too, because it comes from here.
It's hard sometimes for families to understand too that tough love isn't screaming and yelling.
No.
That's coming from anger. And that's valid. We understand very much how family members are going to be angry with the person who's using. But tough love is about setting boundaries. It's about drawing the line in the sand and then sticking to it. So you can be harsh, you can be firm, but if you're hollering and screaming and yelling and getting into a fight with the addict or the alcoholic out of anger, you're banging your own head against a wall.
And I have a little bit of a testimonial here. Janelle just commented a moment ago, and she wrote, I know him, legacy is awesome, I've been there. So you have, you know, not just clients, not just patients, but real people who are getting real results.
Exactly, and I think that's, to me, that's one of the most rewarding aspects of this entire thing, is getting people who call us 4 months down the road, a year down the road, 6 months down the road, and let us know how they're doing. Like Daisy had said earlier, you know, we had a gentleman call the other day, and he took his kids to Disneyland for the first time ever. Something he could have never conceived of doing in his addiction. Not only because he didn't have the resources to do it, but he didn't have the wherewithal or the ability to get down there. And so those are things that are just, they make every day worth it, because it truly is transforming. It's, you know, to see people's lives changed.
So if you are just joining us on this 23ABC Facebook live feed, we want to invite you to give us some of your questions, give us some of your comments. What would you like to ask of Dennis or Daisy about Legacy Village? Again, they are a recovery center. They are a sober living facility. They are here in Bakersfield. They've been around for about 3 years. They have a website. Give me the website again.
We do. It's www.legacyvillagellc.com.
Okay, so you can get some more information there when we're done with our live event here. But in the meantime, I'm taking questions. I'm taking your comments. What do you want to know? We've had people ask us, you know, or tell us, you know, I know Daisy, she's great. You need to give it a try. Recovery is not easy, but it is possible. Give us the phone number one more time for those people who are watching and are ready to make a phone call.
Certainly, you can reach us at area code 661-846-2745. So,
thank you. Let's talk a little bit about the actual living facility. You said they look kind of like apartments, kind of like townhomes, like it's not, it doesn't look like a medical facility,
no.
Right?
No.
How many people, like how is it broken down? Like how many people per unit or that sort of information?
The facility is licensed and we can handle up to 20 individuals at a time.
Okay.
It is a co-ed facility, however, that's segregated living conditions. So each individual housing unit can accommodate up to 5 people. And depending on how many of each sex we have determines, you know, which units are male or which units are female. But we can handle up to 20 clients at a time. You know, again, it's an apartment complex that was converted to this use. We spent a lot of time and care in remodeling it, so it is not like a hospital at all. It's not institutionalized.
Okay. Ladies and gentlemen, I'd like to invite you one last time. If you have any last-minute questions, go ahead and get them in now. Our time with Dennis Farmer, CEO of Legacy Village, and Daisy Graven, Clinical Supervisor there, is running out. So if you have any last-minute questions, we'd like to take that now. In the meantime, I'd like to open it one last time to either one of you. Is there anything that maybe you'd like to share with the people who are watching right now before we let you go?
I'd just like to say that if you're out there and you're struggling and you're having a hard time with this issue, whether or not Legacy Village is the right fit or not, call us anyways and let us at least answer some of the questions that you might have. If we aren't the right place, we've got a wealth of resources we can refer you to. We have a list of phone numbers of places that might be more significant or might be a more beneficial fit to you, whether it's financial, whether it's structurally, whatever it is. At the end of the day, this disease will kill you. It will kill anybody who struggles with it. It may take some time in some cases, and others it doesn't. So if you're struggling, if your family member is struggling, reach out, ask the questions, educate yourself, and take the steps necessary to get the help you need.
Dennis, thank you. Daisy, any closing remarks?
The ones I like to reach out to are the mothers, the single mothers, working mothers that, I know for me, myself, that I was afraid because I didn't want anybody to think that I was a bad mother. And getting treatment, getting help for yourself is not being a bad mom. Leaving your kids for 21 to 28 days is something that you will not regret doing. And there's no shame in seeking help. It's something that is going to change your life for the better forever.
Dennis and Daisy, we'd like to say thank you so much for coming in this afternoon and sharing this hour. It has been a wealth of information. And all of you out there watching, thank you so much for joining us. Until next time, I'm Crystal Figueroa for 23 ABC Facebook Live.